Welcome to a short training presentation we have today on a new HRA alternative strategy available to Medicare primary groups or groups that have less than 20 employees. Back in 2015, the IRS issued some new guidance, and that guidance came in the form of a notice number 2015-17. Now, within this notice, it confirms that employers can establish an HRA that is specifically for employees age 65 or older, and that HRA can reimburse Medicare premiums as an alternative to the group health plan. Now, it's important to point out that this strategy only applies to employers that have less than 20 employees, and Medicare would be the primary payer of coverage if that employee were enrolled in both the group health plan as well as Medicare. Now, there are some specific requirements with Notice 2015-17, and that indicates that the employee must be offered a group major medical plan that has minimum value. Again, this is something that they just have to offer, but the intent is that the employee will be waiving coverage under the group plan. Now, the employee must be enrolled in both Medicare Parts A and B, and premium reimbursements can only be available to those employees who are actually enrolled in Medicare, and those reimbursements are limited to premiums for Part B, Part D, Medicare supplement plans, and if the employer so chooses, can also reimburse accepted benefits, things like dental and vision expenses. Now, with this strategy, by offering the HRA as an alternative to the group health plan, we are seeing total premium savings ranging between $6,500 to $11,200 per Medicare eligible employee per year. Now, the actual savings depend on the specific group health plan that is offered and the actual Medicare premiums that apply to the employee, but the premium savings that are closer to $6,500 per year, that would be comparing the HRA to a bronze-like plan, and the premium savings that would be closer to $11,000 per year would be comparing that to a platinum-like plan. Now, just to take a look at the difference between the two options, the employee remaining on the group health plan with Medicare or opting out of that group health plan to pursue coverage under the HRA, is shown here in this table. Now, first, under both scenarios, the primary coverage would be Medicare when an employer has less than 20 employees. So the employee should be enrolling in both Medicare Parts A and B, regardless of which option they're pursuing. Now, with the group health plan, that would be the secondary coverage. However, under the HRA, the secondary coverage would be a Medicare supplement plan. Under the group health plan with Medicare, the employee would be allowed to see any provider that accepts Medicare. However, benefits under the group health plan will vary depending on the provider's network status within that group health plan. Now, if we take a look at the HRA alternative, the employee still can see any provider who accepts Medicare, and those providers must also accept Medicare supplement coverage regardless of which carrier issues that Medicare supplement plan. Now, when we take a look at cost sharing, with the group health plan and Medicare, that employee would be subject to paying deductibles, co-pays, and other out-of-pocket expenses required by both Medicare and the group health plan. However, with the HRA alternative, assuming that employee enrolls in Medicare Supplement Plan F, they will have no out-of-pocket expenses except for those out-of-pocket expenses that apply for prescription drugs. So the cost sharing related to the prescription drugs under the group health plan with Medicare option will vary based on that group health plan prescription drug benefit, and under the HRA alternative, that will vary based on the Medicare Part D plan that is selected. With the group health plan as well as Medicare, the employer contributions, at least at a minimum perspective, are determined by the insurance company. Usually there is a minimum dollar contribution or a percentage of premium that must be made. However, with the HRA alternative, that employer gets to decide what that contribution is, and they can set that contribution as a monthly maximum, or they can set that contribution as an annual maximum. So there's a very good argument here that offering the HRA alternative, as opposed to allowing that employee to stay on that group health plan, as well as Medicare, that the HRA alternative is actually offering better coverage while also offering premium savings to both the employer and the employee. So this is something we're very excited about. Again, it's available to employers with less than 20 employees. We are a benefits administrator, and we do offer an HRA product. And with that, we can set up the HRA for the employer. We can provide them with the required plan documents. We can help them properly establish the plan. And then the IRS does require that reimbursements are substantiated, and we do that as a benefits administrator. Now, we also are a general agency, and our primary group health carriers are Aetna, Blue Cross, and United Healthcare. We do have some Medicare carriers available as well at the general agency. We work with Blue Cross, Mutual of Omaha, and United Healthcare. We do also have some additional carriers available that offer standalone Medicare Part D plans. Now, some of the Medicare policies out there do require brokers to certify to be able to sell those products. If you have not completed the certification or you are not interested in completing that certification, we can still help you in this process. You can actually refer that member to Flex, and we can help enroll that person into the appropriate Medicare plans, and then we will pay a referral fee to you as the broker. Now, we are very excited about this option. Of course, it is available again to employers with less than 20 employees, and we do think there's some significant premium savings for each Medicare eligible employee, while at the same time arguably offering some better coverage. If you'd like some more information, we do have a one-page summary sheet that we can send out to you. We also have a longer white paper that we've developed on this subject. And if you're interested in receiving either or both, or would just like some more general information, please contact your group sales rep. Their phone number is 888-353-9178. You may also send an email to them at groupsales@flexiblebenefit.com. Thank you very much for your time, and have a great day.